Whether we're talking about the predisposition of genetics, environmental impact, something in your workplace, air pollution, or whether it's a product of your lifestyle choices, it's not as simple as, well, if it's genetic, you get it or you don't.
In the NHS, the doctors are very much trained in asking what, right? What symptoms do you have? What disease diagnosis, what disease label am I going to give you? And then what drugs am I going to prescribe you, or what surgery or whatever else? If we can catch people at that first presentation of where they're presenting with, I don't know, maybe slightly raised blood pressure or their first, high cholesterol level. If we can actually look at what underlying that, at that point, what lifestyle habits are actually generating these problems and intervene, then we've saved them all of that cardiometabolic syndrome conditions later down the line, because if we've intervened at that first point, we've saved the person a lot of problems, and we've also saved the NHS tons of money dealing with the consequences of this down the line. Why is this person experiencing this health problem right now? That's what I'm interested in. So as we know, there's what's called complex polygenic inheritance, those little single letter variants in our genetic code that each contribute a tiny level of risk, and together they will add up to quite significant risk. So BRCA1, BRCA2 are genes that carry a very strong familial predisposition to breast cancer, and they're the genes that are involved in the DNA damage repair pathway. If you get this kind of mutation, a BRCA1 or BRCA2 mutation, then the likelihood of getting breast cancer by the age 80 is 70 to 74%. But in even these, what we call high penetrance genes, let alone the tiny SNPs, physical activity carries a significant risk reduction, despite the genetics. So we know what we do every day carries a massive impact in terms of cancer risk down the line, no matter what your genetics is. And what we are looking at now, certainly in precision medicine, precision health, is looking at maybe some of those smaller genes and some of the other little SNPs. How do they all add up to a risk? But also, how do we use lifestyle and nutrition to modify the activity or the expression of some of these genes to create a personalized plan that will enable someone to stay healthy? And we're already looking at something called precision oncology. So that's about using really comprehensive tumor profiling as well as genetic profiling to deliver more personalized oncology regimes. But what I'd like to see is going beyond the tumor, or even things that influence tumor biology, looking at the person, because the tumor developed in a person. And I don't really want all the focus to be so narrow. I want us to look at the person, about what might predispose them to chronic low-grade inflammation, what might be the gene times environment interactions that led them to this path, or might potentially lead them to that path in 20 years' time. So let's intervene now, because as we know, prevention is better than cure, as the adage goes. So I think it's talking about those 4 core foundations. So small things you can do within each bit. If number 1 in nutrition is an anti-inflammatory diet, however colorful anti-inflammatory you can make it, that's great. You don't need to go keto, you don't need to go restrictive, you don't need to cut things out. Put things in, put color in, put herbs and spices in, put mushrooms, put cruciferous vegetables, berries, all of those things. You can actually put more in and crowd out with the good rather than try to take stuff out. In physical activity, if you hate running, don't run. Do something else, but move your body, because our bodies are designed to move. And that physical movement changes our gene expression and reduces the risk of multiple diseases. When I talk to people about physical exercise, I talk to them about at least 3 legs of the stool. We need a 4th when we get older. So that's about aerobic activity, resistance training, and flexibility, and as we get older we need balance as well. But whatever fun things you can do, and there is no one best form of exercise, is whatever you're going to do consistently and gives you joy is what you need to be doing. Sleep is essential. Actually, sleep has been very well documented in terms of sleep deprivation and poor sleep quality. Not only been documented to increase the risk of multiple chronic diseases, including risk of cancer, but also is a prognostic factor and can really influence people's tolerance of treatment, etc. Preventative health really doesn't have to be complicated. It does need to be suitable for you and something you do consistently. That's really important. It's not about trying to go hell for leather for 7 to 10 days and then go, oh, I give up on this, it's way too hard.